Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I have the pleasure today to be talking with Dr. Wayne Jonas, a family physician who practices at a family medicine residency program in Fort Belvoir, Virginia, and he is also the author of a book, How Healing Works, and he is head of the Samueli Integrated Health Programs, which is an effort by the Samueli Foundation to move our healthcare system towards a whole person orientation to care. Dr. Jonas, thanks so much for joining with us.
It's a great pleasure to be here, Larry. Thank you for having me.
So your book, How Healing Works, which I have to say really got me excited, and I've shared it with many, many others now. I was just talking with people at the University of Dayton here in Dayton the other day who started passing the book around, and they're all very excited about it. So it shares a powerful perspective for a whole person orientation to healthcare. Could you describe for us this perspective?
Yeah, I'd be happy to, Larry. You know, in some ways, this is what family medicine was started for, and but we have moved away from in our healthcare delivery system. You know, when I started 35 years ago in family medicine, there was still a lot of energy and enthusiasm around whole person care. They called it the biopsychosocial model at that time, and over the last 30 years, we've seen that kind of view of taking care of the whole person, their mind, body, and spirit, chipped away at through subspecialization and sort of the division of knowledge, a materialistic orientation that results in pills and procedures, and a volume-based system for doing that. And we are literally chopping up the human being when we know that healing, wholeness, and even holiness all have the original root words, and that we have to pay attention to, and someone has to be the integrator. Someone has to be the person in healthcare that looks at the whole person, that pays attention to what matters to the patient, and then helps them get at their underlying determinants of health and healing on a longitudinal basis, both for prevention, for the treatment of disease, and for well-being, even when they have disease at the end of life. And so this book was an attempt to tell both stories from my practice as well as research from my really global explorations and evaluation as a scientist about how does healing work across systems around the world, both conventional, complementary, and traditional systems, and what does it mean in terms of what we should be practicing like today. And so the book is an attempt to do that, and came up with some pretty interesting discoveries about the fundamentals of healing that are very consistent with the origins of family medicine.
So you talk about the difference in your book between a SOAP note and a HOPE note. Can you comment on that, please?
Yeah, I'll talk a little bit about that, but first I want to just say one more thing about where health comes from and how healing works, based on the data, because I think if we don't pay attention to the facts, they're going to come back and bite us, and they do. We know now, for example, that 80% of health and well-being actually come from outside of the medical system that we operate right now, only about 20%. And this has been documented by studies from the National Academy of Medicine and Robert Wood Johnson and many other groups. And it is the underlying cause for the rise in costs, a declining in our population health outcomes over the last 30 years, and a growing dissatisfaction with the healthcare system, including burnout and lack of satisfaction. And we are no longer addressing these underlying determinants of health, and these are primarily behavioral and social in nature. And so we need to get back to talking about those. We need to ask questions about those, and we need to develop a system that begins to address these underlying determinants of health. And so the idea of doing this in everyday practice is what the HOPE note is all about. So all physicians know and medical students know, others know about the SOAP note, the subjective objective assessment and plan. We learn about it. It's drummed into our head. We do morning report with it. And we also even embed it into our electronic medical records, where the assessment and the plan then become the diagnosis and the treatment. We try to do it within 20 minutes usually in order to get paid for it, and our CPT codes and others are then attached to that. And it sets up a cycle of diagnosis and treatment, and anything else that doesn't fit into that paradigm, the behavioral components around lifestyle, for example, the social and emotional issues to address social support and loneliness, and most importantly, the mental and the spiritual components, mental health issues, and also addressing what matters to the patient, are sort of left out on the side. They may be stuck in here or there into the social history or something, but we don't actually address it. And so the HOPE note, which stands for a healing-oriented practices and environments note, is a set of questions that allow us to bring that back into the dialogue with our patients in our everyday practices. It starts with identifying and asking the patient what matters to them in their life, connecting those life goals to their health goals, and then looking at the personal determinants of health, the behavioral and the social determinants, and actually in a structured way bringing them into the encounter, out of which a personalized health plan that really is whole person in nature can be used to both engage them in their own healing and empower them to do it. And so that's what the HOPE note is about. It's a tool, if you will, for engaging in whole person integrative health in day-to-day practice.
Great. So our current primary care practices struggle on an RVU-driven hamster wheel. What will it take to move from a production-oriented approach like we have now to a healing-oriented approach in primary care service delivery?
Well, that's a great question, and I'm not sure actually what's going to be the tipping point. We're getting, in my opinion, very close, and in some places have passed the tipping point for what you described, which is a volume-based system in which, a fee-for-service or an RVU-driven hamster wheel requires that we see people in short periods of time address their issues fairly superficially. This kind of a model we know, and this has been well documented, does not work for primary care. In primary care, where we're paying attention to the person and not just their disease, we have to have something that brings value to that process. And so recently there's been a lot of talk about value-based care, and they're attempting to move away from this hamster wheel RVU-driven approach to more bundled type of capitated approaches. And I think that's the direction we need to go. So far, it hasn't gotten too far into truly comprehensive family medicine, primary care, but I think if we were to be able to bundle that so we paid for the health of the individual, then we would be creating a system that actually would add value, improve satisfaction, and actually improve outcomes. We'd have an actual health care system, which right now is a triple oxymoron, I call it, because it doesn't produce health. There's not much care embedded into it. I mean, people are caring in it, but the system itself doesn't allow that to get expressed or paid for. And it's not a system. It's not really integrated in any fashion. And I think if we were to shift from volume to value, then we would be able to deliver a healing-oriented integrative practice.
So, Dr. Jonas, I know that you're aware of what the DA is doing, and there are a few models out there where they've begun to move in this direction. Could you comment on those?
There's a number of them, and actually at the FMEC meeting, upcoming meeting, both at the meeting and the Innovators Network the day before that, you have gathered a number of those innovators, including the new approach the VA is starting to take called the whole health model, as well as a number of other groups that are focusing and showing how both lifestyle and patient engagement models can be delivered. And so I think coming to that meeting, for those that are interested in this, will allow for them to see this in practice, and I'm hoping then we can form an approach where the innovators at FMEC and others can begin to learn and implement some of these things in their own day-to-day practice.
Great. So you're going to be, along with Joe Scherger, offering a plenary session on Saturday morning at our annual meeting, and you'll be one of the leaders of the Innovators Network meeting on Friday. And what's your dream? What's your hope where this may lead us?
Well, I'm hoping, number one, that those that come to the meeting overall and our sessions in particular will be inspired to see that it is possible to deliver in family medicine the type of healing-oriented practices that most family docs went into practice to do. It is possible to do that. So I hope they get inspired with the concepts of integrative health and the Hope Note and healing-oriented practices and the lifestyle components. And then I hope they go away with some practical tools. And I'm in the workshop that I will do following my plenary talk, I'm going to dig down in and show you some of the tools we use in our own practice in Belvoir, and also pull in tools that are being used at a variety of other places, such as the personalized health inventory, the Hope Note, lifestyle assessments that can be implemented in day-to-day, everyday family medicine, as well as processes that then allow you to actually support the patient through those kinds of changes. Health coaching, group visits, and hopefully how you pay for those things. How do you bill for those? So at the end of the day, we're going to make a call for those who are interested in, rolling up their sleeves and doing this type of thing, creating a healing-oriented healthcare in their own practice, to join a learning network. And that learning network hopefully will continue over for the next year and after that to actually test these integrative models in their own settings, to learn from that, to collect some information and data on that, and then to come together and share that information. And in this way, really create a movement for integrative whole person care.
Great. So just to add to that, we've been working behind the scenes to invite what I call early adopters. Those are people who are in different practice settings who are actually looking for new ideas, new approaches. And we have people coming from FQHCs, we have people coming from independent practices, from hospital-owned practices, and from direct primary care practices. And I think, based on my conversations with these people, that there's going to be a very positive response to what you're talking about and what Joe Scherger will be talking about and some others. And I think the idea of forming a learning community that will go forward, the FMEC is very committed to supporting this. Our goal is to create a tipping point in the U.S. healthcare system so that we have a primary care-driven system that's leading the charge, and that primary care system is whole person care oriented, which I think I'm a social worker by training, but I got introduced to family medicine back in the late 70s by what are now called the founders, and this certainly aligns very well with their vision for what they hoped would happen with the U.S. healthcare system.
I think that's fantastic, and in my experience, having run a number of these learning networks, breakthrough learning communities, the variety that you talk about from different kinds of practice, FQHCs, hospitals, independent DPC, et cetera, you get a good variety of folks participating, then they each gain tremendously from that diversity. They learn from each other things that can be done very widely. And then you get more and more towards showing how one can truly change the system and what a universal primary care model that could spread around the country would actually look through. And that would be a tremendous breakthrough. And I'd love for anybody who's interested in being part of that, those early adopters and implementers, to come and participate.
Great. Well, I'm looking very much forward to working with you on this. I want to thank you for talking with me today, and I look forward to seeing you in a few weeks.
Great. My pleasure. I look forward to it too.